The vaccine shortage has also hindered the inoculation drive in the state of Tamil Nadu. The MK Stalin government will stop the vaccine drive for 3 days from June 3rd to June 5th. The State Health Secretary has said that a fresh batch of vaccines from the centre will come on June 6th, after which the drive will again resume. The state government revealed that 42 lakh vaccine doses have been allotted for June, which is double the number that was actually provided to Tamil Nadu for May. The government is also awaiting response to global tenders that have been floated for vaccines for the state. Tamil Nadu is also facing a crunch in black fungus drug amphotericin. Remember that the state so far is reporting the maximum number of cases across the country, and that's why the focus has been on the vaccination drive and ramping up the vaccine process.
What about the vaccination scenario? We also heard that the state is running out of vaccines and probably there could be no vaccines for a couple of days.
See, basically, the next month, Government of India has packed in more than double. The current month, they had given 20 lakh. Next month, they have promised 42 lakh. But, and overall also, against a supply of 96 lakh, we have spent 87. But in the beginning of today morning, we had 5 lakh, discounting wastage on hand. Knowing the pace, it will last for 2 days. But the first available supply from the next month, and the current month we have 1.74 to be given, which may land up in the next 2 or 3 days. But otherwise, we are hoping to get the vaccines only in 6th, based on the supply logistic line, which is already made. It is not as if that sudden change. So there is likely to be a break of 2 to 3 days because of logistical issues. We may not get the supply, though we are slated to get 42 lakhs coming month. See, lysosomal amphotericin, which is the drug of choice, is in short supply, and Government of India is making allocation depending on the number in each state, and we have been given roughly around, I think, 1,700 odd vials. But our cases are rising by the day, and we are roughly around 468 cases so far. So obviously, around 50 vials a person, it is quite a high number. We will require higher number.
Let me take this across to Pramod Madhav. He's joining us live from Chennai. He just had that conversation also with the Tamil Nadu Health Secretary. And Pramod, going by what you spoke with the Health Secretary, it's clear that the good news is that they're getting more vaccine doses in June. The bad news, however, is that there's a delay in that, which means that a couple of days the vaccination drive will be halted at a time when Tamil Nadu is the worst affected state in the country, going by the number of cases.
Absolutely. The numbers have significantly also been increasing in the past May. But as you could see, in just 3 weeks of lockdown, we have considerably reduced the number from 36,000. It has come to 28,000, yes. But still it is highest, and it is a bit scary as well. But however, the state has also increased the vaccine drive from 60,000 to 2.5 lakh per day, and this is where, as per logistics and number, it seems like the state has only 5 lakh vaccines in its hand, and it will get by 2.5 lakhs per day, it will get over either today or tomorrow, and that's the reason we are expecting a break in vaccination for 3 days. The health minister said the next batch is going to be available only by 6th, and the health secretary has mentioned that the one good factor here is that last month it was 21 lakhs vaccine doses. This month it's going to be 42 lakhs, and they're also still waiting on the global tender, which is also they are expecting a response only on 6th evening. So that way there is a little bit of issue in the state that has to be handled. And yes, just like you mentioned, the other factor is also about the amphotericin. This also the state has requested the centre to increase the doses.
At a time when the government has been battling the issue of vaccine hesitancy in Tamil Nadu, now you've got another hurdle, which is shortage of jabs. Pramod, thank you very much for joining us with all those details.